How are you?
Good, thank you. How are you?
Well, thanks. Can you hear me and see me clearly?
I can hear you. Can you do the same for me?
Great. I can see you clearly. You look very beautiful.
Okay, thank you. That's so kind. And so do you. Little ones?
Okay, so we'll just give everybody a couple of minutes to join.
Yeah, sounds good.
Okay, perfect. Okay, so me and you are going to be chatting on what to expect during pregnancy.
Yeah, sounds good.
Uh-huh. I don't know if this is recent, but my baby is 3 months old. So, and I had her 2 weeks into lockdown, after lockdown, sorry, before lockdown. So she's seen nobody except immediate family.
I know, and I just find the babies in the clinic are like horrified when they find that there's somebody else other than their family members, and they've got these masks on, and they're like, "What is this?" For little things. Yeah, it's sort of saying, "Where's mama taking me?" All these people. Shit, for little things. I can say it's going to be enough. Yes.
So, Sister Des, tell us a bit about yourself before we begin.
Sure. I'm a mom of three. I have 4 adult children, obviously, and no grandchildren yet, sadly, but hopefully only with one of the 3 married. So we're not expecting to have, little ones too soon. But I've been doing baby clinic and antenatal classes for the last 30 years. So really been enjoying it. I really enjoy the community that I have with couples and just seeing them through this preparation for pregnancy and then becoming parents and seeing them become more and more confident in their abilities and then eventually second baby. So I'm really enjoying it. It's a very special part of midwifery education and things like that. Yeah. So I have my own channel and yeah, really enjoying it.
Okay, I'm just going to turn the volume up. All right, perfect. I see we got some more ladies that have joined. If anyone's pregnant, please shoot us some hearts. So we know we have some expecting moms in the house. All right, just a bit about myself. My name's Lana Tillack, and I'm from Pretty Brave Mom. And I'm a parenting blogger, lifestyle blogger, and I have 2 kids. One is 2 and the other one is 3 months old. And the 2-year-old keeps me more busy than the newborn. I don't know if that makes sense.
That is exactly what happens because the second time around you're way more relaxed with the baby because they do
Yes.
grow up despite you. So
much faster. And she's my easy baby. My first baby was my hard baby. So yeah, my second one's growing up really fast. Okay, so today we're going to be discussing changes in your body during pregnancy. So I'm going to be asking Nurse Des a couple of questions. If anyone's got some questions, please just shoot them below. I am going to note them down and I will ask Nurse Des. All right, so let's start with question 1. So during the first 3 months of pregnancy, I know I battled with this one. Can you tell us a bit more about morning sickness, and is it really real? It's not made up in our heads, and do you know the causes? And also just tell us what we can do to minimize the nausea.
Right. Well, basically, we have to blame everything on the hormones. Right from day one, our hormones are completely different in the sense that the volumes increase a lot. And I think our bodies just go into a bit of shock. They're actually not really expecting to, like, what is happening? What is this little foreign body in our body? To adjust around that. And so there's some theories to think that possibly maybe it's your body's immune response to the foreign tissue of your pregnancy that makes some moms feel quite nauseous. Other people say it's your brain trying to figure out why our hormone levels are so high, because obviously estrogen and progesterone and the other hormones of pregnancy, human gonadotropin, things like that. Different people different ways to that. And so unfortunately, some of us have varying degrees of nausea. some people are only queasy during the morning, and for me, that's sure they know that it's like 24/7, that you are just nauseated. Some actually vomit, and then some moms even have a situation like Princess Kate. She actually has upper remnants gravidarum, just don't stop. You can lose weight, and both mom and, well, not so much the baby, they don't care. They're sort of, and they're quite safe, but moms are, you know, sort of the nutrition and that does suffer. So
okay, what sort of nutrition, sorry Nurse Des, what sort of nutrition is important like during that time? I know I used to have orange juice, so, and it's the sourness would take away the nausea.
Absolutely. And I found for me, sucking barley sugar seeds, strangely enough, would help the nausea. So basically what we have to try and do is be sure that what sometimes happens as well is if we are so nauseous we don't want to eat, and then what happens sometimes is our blood sugar levels will drop, and that will be more nausea. So it forms like a little bit of a, you know, a vicious circle. And so obviously with us drinking fruit juice and sucking the sweeties, or having like a little biscuit with Marmite on it and things like that, just sort of lessens the nausea. So sometimes the first thing that the mom needs to do when they get up in the morning is to have something to nibble, something really small, like a, you know, little Provita with some Marmite on it, or suck a sweetie, or, you know, sip a little bit of juice or something like that. And then of course then things like ginger, you do get like ginger, yeah, because ginger is known to help with nausea. And then there's some moms that swear by like a pressure thing on their wrist. Am I speaking?
That's good. Okay, wow. One last question on this topic. I'd like to know, how long does it last? Me and my husband have had fights about this. For Kirsten, my first son, my first baby, I had it right throughout till I gave birth. For Harper, my second baby, I had it for 3 months. Some of the ladies before this had asked me a couple of questions, and one, while we're on this topic, I just want to know, how long does it more or less last? Am I making it up in my head, or is it real?
You can tell your husband you're definitely not making it up at all. It does happen sometimes that women are nauseated in pregnancy. Sometimes it's only the first trimester, the first 3 months, and then your brain and your body adjusts to the pregnancy, the level of hormones and hormones. And for other women, it just doesn't happen. It keeps on coming through. Some ladies will be nauseous in the first trimester, feel fine in the second trimester, and then find that you know, the womb is so high up and pressing up against you, nausea returns again, and they feel nauseous the whole way through the third trimester. So it's difficult to say for each mommy exactly whether they're going to be one of the that are going to go all the way through like you did, or whether it'll just be the first trimester. But it looks like your body's got used to pregnancy, so with your second one, it wasn't too bad. And then some women will swear by the fact of different sex. They'll say that they feel much more nauseous with having a little girl. So I was nauseous with my boys, and with just very, very 24/7 nauseous with my boys for the first trimester with birthday. But with my daughter, I vomited to like 24 weeks. So maybe there's something in that, you know, too many female hormones, and your body's like, oh, what's happening? But yeah, unfortunately, it can sometimes happen for some moms, which is really unfortunate, because it's not, as you know, it's not very tiring to be nauseous all the time.
Okay. Nurse Des, we've got a couple of questions. We've got one on brain, pregnancy brain, but I just want to let the viewer know we're going to get to that question, pregnancy brain, but there is a question concerning this topic, and the one lady has said that she can't stand the smell of raw meat and chunky pieces of meat. It has her feeling sick. Okay. I can relate. I hated the smell of fish and meat.
For me, it was when you just start cooking mince and it's gone grey, it has that smell. That was my worst as well. That's where that correlation between smells and nausea kicks in. And so that's where they're coming with the theory that maybe it's got something to do with preventing moms from eating food that might not be good for them. And so very often cooking meat and certain smells of food and that have a very strong reaction for some women. And so that's part of that, where that theory comes in, that maybe it's the way of your body protecting yourself. Or protecting the pregnancy from eating anything that potentially is harmful. And so we can be very sensitive to certain smells, and cooking meat is definitely one of them that's common for everybody. And cigarettes, the smell of cigarette smoke as well.
Yes.
Sometimes, don't handle that. And we all know cigarettes are not good for pregnant moms, so there you go.
Okay, alrighty. I'm going to move on to the next question. If anyone's got more questions, I'll just note them down for later. So, during pregnancy, I found myself doing some bizarre things. For example, I would get told something and I would need to get told it 3 times before I actually do it. So we've come to the question of pregnancy brain. Is it real? Is it fake? Is it in my head? For me, it started around 4 months and it continued throughout. And this is not even getting to the tiredness and all of that stuff. We're just talking about pregnancy brain here. And
pregnancy brain is definitely a thing. That's definitely a thing. People think it's probably got something to do with the relaxin hormone, which is a hormone that really increases significantly during pregnancy. And it definitely does result in a lot of forgetfulness, a lot of sort of muggy thinking, and not really being able to communicate. And I think it's also, to a certain degree, towards the end of your pregnancy, the pregnant brain actually tries to get you to slow down. Because, you're growing a baby, your body starts turning to preparing for birth, preparing for mothering this little one. And so you're not really too worried about, that fast-paced life that used to be, that you like can think 20 things at one time. You sort of physically slower, and then we do become a little bit mentally slower. And then, of course, there is a thing going around is that a pregnant mom's brain shrinks and gets smaller. And that, of course, contributes to us being a little bit sort of a bit slower. That is not the case. It's not really part of the preggy brain thing, but it definitely does say that a preggy mom's brain does get a little bit smaller. We contribute quite a bit of the triglycerides to our preggy, and but that does recover again afterwards and goes back to normal. So there's lots of theories about that. But preggy brain definitely is a thing.
How long does it? Sorry, no, Steph. Silly me. I just want to know, how long does it take to go back? I'm quite eager to get my brain back. I know it's only 3 months that Harper's born, but I mean, as soon as I had my body and my brain back, I fell pregnant with the next baby. So I'm worried, is it going to take 2 years?
Some moms say it never comes back. No, look, obviously as your hormones recover, so that you'll get that sort of mental acuity back again. But relaxin hormone stays in your body for a very, very long time. And so that's why some moms have to be really careful when they go back to having, doing exercise and gym and things like that. That's the
so exercise. Okay.
Yeah. So basically, so you still have to be quite careful. So obviously, if the relaxin is in your body for another 6 to 9 months, you can expect to have that as well as your preggy brain lasts for a bit longer. But I think also what contributes to that is the lack of sleep. You're not sleeping, and as much as we did beforehand, you're physically tired if you're resting. So there's a lot of physical changes happening in your body. It also contribute to mom's and more turned in towards caring for your baby as opposed to worrying about what the stock exchange is doing and that kind of thing.
Okay, we got a question from Jamie, and she says that she wants to know, why did her husband smell like iron? It made her so sick. So she's obviously have the strong smell of iron. Not a pleasant smell.
Yeah, that's quite interesting because obviously our sense of smell and taste is heightened as well.
Okay.
Yeah, and I'm sure you've a lot of moms can say that's part of the reason why we are sensitive to the smell of meat and certain other smells and things like that. And then of course our sense of taste. I must say, by the time I got pregnant with my 3rd baby, before I even had a period or had sore boobs, my sense of taste changed, and I got that metallic taste in my mouth. And I said to my husband, "Oh, I'm sure I'm pregnant," because I remember that happening with the others. So a lot of moms say that this taste of food and things like that is tainted with a metallic taste and metallic smell. And once again, it's nature making you very, very careful about what you eat when you're pregnant to protect the pregnancy. Why he smelled like iron, I'm not sure. Maybe it was his aftershave, or maybe it was the smell of his skin, his pheromones, because she was so sensitive to it.
Sorry, yeah, I can relate. Where my husband is a millwright, which is your mechanical slash electrical engineer, and he works in obviously the mechanical department, maintenance department, and he would come home and I would get the strong sense of smell just off his clothes, and it would completely put me off. I would want to eat food. I would even say, like, how do you hang around that spot? And then along came my pregnancy with Harper, and I love the smell of red sand. Red sand does have a smell, everyone.
And how our bodies are,
How bizarre, how strange, but I found myself always wanting to be near the red sand bank at work because it just had this like clayish smell, and I loved it. I don't know.
Well, that's
just sharing.
That red sand has got a lot of iron ore in it, so maybe there was something about the iron that was attracting me. I need that for my baby. Yeah, amazing what our bodies do here. We just don't even have to think about it. They just do it, and it works.
True. And around 5 months into my pregnancy, I had the uncomfortable conversation, obviously, with my spouse that I can't go to the bathroom. Why does this happen?
Right, yes. Oh, constipation, shame. That is always a bit of a thing. Well, basically, first of all, with pregnancy, especially more advanced pregnancy, you don't have more space left. Your bowel is very much pushed up against your spine, and there's not much space for everything to move around.
Okay.
Fast as it used to. We're very often on added iron as well in our tablets and stuff. Yeah, capsules. And so very often that contributes to constipation. And then obviously we're not as physically active necessarily as well. We tend to obviously what beforehand we would maybe exercise more often. Also may not be drinking and eating enough fiber and drinking water in our diet. So very often things do change. So moms sit down and look if any of those are a guilty party as contributing to constipation. Because obviously if we say like, okay, I could drink more water, or I could eat more fiber and that, or
more fiber. So more fiber, okay.
Well,
and what are some of
you want something that's going to be a bit bulky. I mean, obviously you don't want to buy over-the-counter medications without chatting to your doctor, but very often
what are some high-fibered foods that you would suggest for pregnant ladies? Just you can name just 2 or 3.
Your fruit and vegetables, and your high-fiber bread, and like brown rice. Or we chop everything over to whole wheat, all the white stuff. And then, of course, your posture when you go to the toilet as well is very important, to actually make sure that your kneecaps are higher than your hips. And so that just helps your pelvic floor to relax, and the muscle that hooks your anus to the side like that will then relax, and then you'll be able to pass it through without having too much stress. So what that would entail is either get like a little plastic stool, if your toddler has a little maybe to go into the toilet and has a little steppy stone, sort of like a plastic stool, or you can buy a poo stool, or just have sort of like any little upturned basin, so that you put your feet up on that and you bring your knees higher than your hips, and then you lean forward on your elbows and try not to strain. Don't force the stool out. Try and rather breathe it out, like going, as opposed to
we're practicing for labor.
Practicing when the baby comes. But it's very, very, very important to correct your constipation when you're pregnant, because it can create a lot of strain and damage to your pelvic floor. Constantly having to strain at stool and things like that. So always, if you are battling, try and get it out of your diet, or chatting to your and your posture, and then chatting to your gynae about getting a stool or bulker. Don't struggle. Yeah.
Okay. Last year, August, I discovered I was pregnant, and very, very quickly into the pregnancy, I found myself at work every single lunch break, tea break, sleeping in my car, exhausted. And I also, this is a good question here. If I went into a room like this that I'm sitting in with the door closed, I would immediately feel my eyes heavy and I could not see, and I would want to just sleep. And obviously this shows a sign of disrespect in the working environment. Plus, I work in HR. It's one of the rules is you get fired for sleeping on duty. But that's what I'm saying. I would go to my car, have naps, and I want to know, and many other ladies, and I saw there is a question right at the top about fatigue, tiredness. Is it real? And why does this happen?
Very real. It's so weird that at the beginning of our pregnancy, when you think about it, baby is the size of a grain of salt, a grain of rice, and yet it makes us so tired. And once again, it is just that hormonal changes. It's what your brain is just going like, what is this? And your levels of hormone in the early stages of pregnancy are so high that they actually make you feel that sort of sluggishness, this tiredness. Okay. And nature's way of wanting to go and rest. And then usually in the second trimester, you perk up again because your body and your brain is adjusted to those hormones and they're not sort of like in shock. And then you feel well. You know, you have energy, you want to go around, it's fine. So that's why that second trimester is such everybody now knows that you really, not just that you're quite bloated and that, you know, pull your tummy in, what's wrong with you? Oh, she's preggy, that's so cute. And you're feeling well, you're glowing, you're looking good. And then we're going to the third trimester where, of course, physically you are now carrying around a baby. You're weighing maybe 10 kgs more and you're lugging that around. And nobody says to you, oh, shame, let's go and have a rest because, you're pregnant and you're carrying around all this extra weight. Your boss is going to say like, pregnancy is self-inflicted, There's nothing wrong with you, just carry on. But you are very tired because your body's growing a baby. It's growing another human being, and that energy has to go somewhere. And so we need that rest. It was good for you to have gone and had those rests and that because then you would have coped better. And that was your body saying to you, I need you to take a break and go. So listen to your body.
Okay. That's good. I'm glad to hear that from you, and I'm sure everybody else appreciates that. Just before we finish up on that question, I just want to know sunlight. Like staying warm or vitamin D. I was very drawn to being in the sun and wanting that to absorb vitamin D a lot while pregnant. Is this normal or is it just me liking the sun?
Like a little cat going to lie in the sun the whole time. No,
yeah.
And I think it's instinctive. Because you know what, you need to be, to get your daily dose of vitamin D, you need to spend at least 4 hours a day in the sun, which we do. And if we ever spent that long in the sun, we would normally put sunscreen on ourselves. And so we don't actually get a lot of vitamin D from the sun like that because we are limited by our exposure. And then, of course, you have to try and get it from your diet. And so you really have to have a perfect diet. If you're nauseous and tired and you're not, when you come out of work and you're too tired to make supper, you tend to sort of skim for what you're eating. That's not going to necessarily make sure that your diet is correct. So you've got to be really careful that you make sure that you get enough vitamin D. And it also boosts your immune system, especially now with the coronavirus going around. Zinc and vitamin D and vitamin C are the vitamins that to concentrate on. So being able to sit in the sun, sort of early morning, late afternoon when the sun isn't too strong for your skin, just get as much exposure as you can. 15 minutes here, there, during the day, on your legs, on your arms, on your face is good for you. I think you were just instinctively following that's what you needed to do for health and for pregnancy. So it was and it's relaxing to do that. And you get a tan.
Yeah. It is. The next question is quite a good one as well. And this is a question I get inboxed on my personal account, my parenting blog, Pretty Brave Mom, a lot about, and it's something I've suffered from while pregnant and postpartum. It is, why do we have skin changes during pregnancy? I don't mean to put myself in the limelight, but I did have pretty nice skin before having the baby and while pregnant. And then when I got pregnant, pimples just came up. I know it's hormones, but is it really hormones or was it diet? What is it?
It is hormones, definitely. So some moms will find that they get teenage skin again. Their skin becomes really greasy. You might have acne, breakouts again, because of the hypergenic of your pregnancy. Other moms will find that their skin becomes very, very dry and quite flaky. So yeah, once again, as I said right in the beginning, let's just blame everything on the hormones, and then we'll be like pretty like close to what what's happening. And yeah, so basically, that very, very often in the beginning of your pregnancy, you'll find that your skin will just get like pear-shaped, and then she will settle down, and they might get quite dry towards. And then, of course, you also get those changes and things like that as well, where you have, you'll find that chloasma, those little brown marks on your skin. That one thing you have to be careful of when you're sitting in the sun. If you're prone to getting those, the chloasma, obviously sitting in the sun without on your face, they would actually exacerbate that and make that quite dark, a lot darker. You'll find that the areola, your nipples get darker and bigger. There's that line that forms on your tummy, even out in your armpits and your groin get a bit darker. And that is all from hormones. And so everybody's body would react in different ways. Some people say, I've had the most beautiful skin and nails and hair in my life when I was pregnant. And then, 3 months down the hair all falls out because it all catches up because it's gone out of the growth phase. Because when you're pregnant, your hair doesn't, you don't lose hair. So you've got your hair growth is in the resting phase or the growing phase or the falling out phase. So you don't get the falling out phase during pregnancy. Everything is just grow, 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 grow. And so you've got the growing phase and the resting phase, and that's why you have more hair. Your nails are usually often very, very, grow quickly and are really beautiful. And so, but then, of course, once hormones recover again, your hair all starts falling out because everything that was resting and growing now catches up into the falling phase, falling all over the place. And then you're
all over the place.
So it very much is a case of like, how is your body going to react to your hormones? So if you found that as a teenager you had breakouts, or you tended to always have a breakout, you're quite sensitive to hormones, so just before a period you may have a breakout, it's pretty likely that you may have a similar kind of thing happening when you're pregnant. And then that would be a case of trying to, just go into your breathing and trying to get help to control that excessive greasy breakout. Or you might find it's really dry and you need to make sure that you're moisturizing your skin after it for those 9 months. But once again, it's your body just adjusting. Blame on the hormones. Blame it on the hormones.
I wish I could have spoken to you last year. Even in my second pregnancy, I felt so insecure and was busy Googling late at night, wondering why I'm getting little, like, if I can call it, it looks like a white wart above my eye. And apparently that's hormones as well. And a friend of mine got that brown patch you were talking about across her cheek.
Yeah,
and the areola of your breasts gets darker, doesn't look very pleasant. And tons of body changes. And gosh, I don't know when the hormones will be relaxed. When do they go back to normal?
They do. They do go back to normal again. I mean, remember, I always say to moms, you know what? It takes your body 9 months to grow a baby and to birth a baby, and so you can't expect your body to bang back again. I mean, don't look at those the women that are on Instagram and some of those bloggers and that look as if they've got their figures back straight away. I promise you, they've got Spanx on and they and sort of Photoshop and all sorts. There's plenty going on underneath there. That's genetics. The majority of us are real women. Excuse me. And so we will have loose skin and we will have breakouts and our hair will fall out, but we have a baby to show for it. So, and it recovers, it all goes back to normal again. So our bodies are very resilient.
And around the next topic is on heartburn. And I only suffered with it once. So and this was my second pregnancy, I only suffered with it once, and I used Gaviscon just in that moment and everything was fine. But the main question here is, why does heartburn occur? I mean, there's an old wives' tale about that the baby has long hair. Well, both my kids have long hair and were born with long hair, and my son, I never had heartburn. So I guess I'd like to know from you, instead of Google, why does heartburn occur?
Okay, well, first of all, if your child has lots of hair, that's just your good genes that you passed on to your baby. It's got nothing to do with whether or not mom's had heartburn. So basically what happens is that relaxin hormone, we have relaxin in our bodies all the time, okay, men and women. But it plays quite a role in our period, our menstrual cycle. And so when we ovulate and we release the egg cell, that little bit of tissue that's left behind in the ovary is called the corpus luteum. And the relaxin actually gets released. And then if you don't fall pregnant, it plays a role in us actually having that inner lining in our womb that sheds and comes away as a period. But if you fall pregnant, that corpus luteum sits and gets bigger. And so you have much higher levels of that relaxin hormone going into your body. And so one of the jobs that relaxin does, besides making us like a little bit deaf and a little bit slow in the brain, is it actually softens and smooths, our ligaments and our tendons in our body to allow the pelvic floor to open and the pelvis to bone apart like this. Okay? So we've got big ligaments over here and over here, the sacroiliac joints, and then in the front here. So relaxin works on those joints and makes them a lot more sort of relaxed and sort of able to open eventually for the baby. But unfortunately, your body doesn't say, okay, relaxin hormone, you're only allowed to be in the pelvic area. It's all over. So it has that effect on all our ligaments, all our tendons, and also on our smooth muscle. And so that does affect our bowel as well. As we were talking about constipation, it's also the effect that our bowel isn't actually having those muscular contractions because the relaxin hormone makes the bowel a lot more sluggish. And so you don't get the stool to actually go through as quickly as before and becomes harder as well. So one of the things that it also has an effect on is, it's once again all over our body, all over our, the pelvis, all over our ligaments and the tendons. And sorry, so what the question was? I lost track of it. It was long. Sorry.
That's fine. I'm saying heartburn. So I was actually listening and enjoying it because you've explained that the hormone is supposed to be there by the pelvic to open and let the baby come, but it goes everywhere. So it messes up our skin, messes up a lot of stuff.
All our ligaments, all our tendons. And so, yeah, with my long story, I actually lost track of where I was going to. It was the stomach. So that little muscle at the top part of our stomach, okay, is made of smooth muscle. There's one at the top, one at the bottom, and you've got that bridge shape that our stomach is. So because of pregnancy and the hormone relaxin, that little sphincter is a little bit sort of, it gapes open. It's a bit slack. It isn't tightly closed. And we've also got our the rising uterus, that's the womb that is actually pushing up as well, that is going to push your stomach sideways. So it's very easy for the stomach contents to actually wash up into our esophagus, which is the tube that we swallow with. And so we get that reflux and the heartburn, and the reflux and the heartburn, which then obviously can contribute to nausea as well. So that heartburn of pregnancy is traced all the way back to that baddie called relaxin hormone and the effect that it's having on smooth muscle and the position of your stomach. So that's why you can get heartburn just from drinking a glass of water. It doesn't even have to be like a curry or rich food or anything like that. It's literally just washed, sort of the stomach contents are leaking out the esophagus and that gives us the heartburn of pregnancy. So yeah.
Okay, let's take some. Sorry, carry on. Sorry, carry on.
No, that's what I'm saying. Yay for Gaviscon, because what that does is it forms that little blanket, in the cartoon advert, and it stops it from entering up into the esophagus, and it gives you relief. Yeah. Shame. Thanks for going through.
Yeah. Makes a lot of sense. Let's take some questions. Anybody got a question that would like us to answer? Just gonna go through and scroll and see. Okay, a lot of people are saying they couldn't stand the smell of red meat.
Yeah. Okay. That's just that smell of cooking meat.
Jamie said she had the worst breakouts ever, so now we know why. Another lady said that her hair growth was incredible after pregnancy. Is that also hormones, Nurse Des?
I didn't catch that last one. What was incredible?
So, Narusha said that her hair growth was incredible after pregnancy. Is this also related to hormones?
Not so much after pregnancy, definitely during pregnancy, because as I explained, that resting phase and the falling out phase doesn't occur. So it's just growth and resting layers of the hair in our head. And so we normally lose up to like 100 hairs of our head every day. So for 9 months, you're not losing them. And it makes up for it a few months later when our hormones recover back again. Hair loss literally catches up. You're not actually physically losing it. Yeah. So yeah, she probably knows that for yeah. And so then it all goes back to normal again.
Okay. Amara's got a very good question. I hope she's still here. Amara, are you still here? Just send us some hearts. Amara from Mod Momsy. She's a good friend of mine. I would also wanted to ask this question. Why do we have weird cravings like soil? I know we touched on iron. We spoke about me liking the smell, but she mentioned soil. I like the taste of baby powder, which has talc in it, which isn't very good. No. So yeah, if you could touch on that, and okay, yeah, if you could just touch on that.
Yeah, weird cravings and tastes like that. A lot of moms crave charcoal. I'll eat lumps of coal. Ice, just crunch liters and liters of ice. It's called pica, and basically it means that you have an unusual attraction or wanting to, an overwhelming desire to eat something that's not normally eaten. Like powder. So pica basically is a way of your body trying to recover whatever is missing in your diet. It's usually diet. So for example, a very common one is for example, ice is that the moms sometimes have a low iron level. They're actually a bit, and so your body, instead of like saying, well, go and eat the meat, just go and eat the ice. But that is often a common thing. So when you look at your diet, improving your diet, will disappear. And so often in the first trimester, a lot of moms are not supplements in their diet, or they're very nauseated and can't take it because it makes them more nauseous. But as soon as the nausea disappears and you go back onto your supplements, i.e. improving your diet, your nutritional status, the pica will disappear and you'd stop eating talcum powder or soil, charcoal, things like that. So if you are having cravings like that, that's your doctor, because maybe you just need to have your diet checked.
Okay. Perfect. That's great news. I must say I'm enjoying this, and I really wish I had spoken to you last year. So many questions answered, and I see a couple of ladies are saying so many questions answered, which helps. I've got 2 questions coming up. I'll ask the first one. The first one's by Rosalind from this Higgledy Piggledy Life, and she's asking this. Roz, I think you're beautiful. But anyway, she says her hips have never recovered after 3 pregnancies, and she lives in constant pain. And she just wants to know, is it common? Why does this happen? I know I've heard this recently, and people have been saying take collagen for joints and pains and stuff like that. But yeah, if you could just touch on why does this happen? And is it common too? Because she's obviously just thinking worst case scenario now. What does she do?
Basically, if she had from the very first pregnancy and it's subsequently the first with the 3 pregnancies, then sometimes what often happens is there's some sort of underlying infection. You're a kid, you fell off a bike, or you hit off a horse, or something like that. And then, as you know, because you're young and you're exercising and you're moving around, your muscles and everything are actually supporting that injury. Then, of course, you get relaxin hormone, as I explained to you, and you have that instability in your pelvis, and you start sometimes having lower back pains, coccyx pains, hip joints, and that kind of thing can flare up and start up all over again. But then, generally speaking, what happens then, obviously, once your relaxin moves out of your system again, that can recover, and and it flares up again with the next pregnancy, and then as you're getting older, it could get worse. So I wouldn't say that it's normal. To me, it sounds like you've got some sort of lying issue. Sometimes what happens with women as well, they have vaginal deliveries with very big babies, possibly maybe with her gone back into position again properly. So she probably needs to have an assessment maybe with a pelvic floor specialist, and just have an assessment and see what is actually going on there. Because if she's got pain in her hips that she had when she was pregnant, I think that old injury or old situation is cleared up again and hasn't resolved. So I would just go. I would definitely go and have it checked up, because it's not fair to stay like that and just say, it's just from pregnancy. She definitely can't get help. Yeah. So.
Stuff we ladies go through to have kids. Oh my gosh, so many changes. Sure. Okay. This is quite a common question, and my husband also wants to know this. I mean, he's curious. Why do we have high blood pressure? Around 5 months a year, a lady needs to go into hospital and have her blood pressure checked. And diabetes, I also want to know this. Narisha has raised this question, and I'm also curious as to why the diabetes part, what has that got to do with everything, and the high blood pressure?
So basically, there's usually always some sort of underlying issue with your blood pressure and or your diabetes. Okay, so you're not actually, maybe you are pre-diabetic, due to diet or just your history or anything like that. So obviously, when you're going into pregnancy, we have something called gestational diabetes, and it sometimes just triggers some women over to a diabetic state whilst they're pregnant. Very often that can resolve with diet and managing diet, and certainly afterwards once baby or babies are born. But you do have to be very careful, because later in life, when you get into the 40s and 50s, you start becoming menopausal, that diabetes can come back again, into your life. So if you had gestational diabetes, just keep that in the back of your mind, that you need to just be careful of your diet and how you're eating, and get nutritional advice from a dietitian to make sure that you don't flare up with diabetes later in life again. With hypertension, some women are hypertensive anywhere as they're going into pregnancy, and obviously this flares up again. It could be like a situation. Some women will have high blood pressure during their pregnancy, and they're absolutely fine again afterwards and never have a problem again, when they're not pregnant. So sometimes there are some theories that maybe it's got something to do with the placenta. There are a lot of theories about it, because it's very often common in pregnancy. Hypertension is often common in very young women, in their teens. It can flare up then. Sometimes it can be in a change in partner, when your baby's partner is different, your baby's father is different to maybe another pregnancy that you had. You can suddenly have a flare up. So they're not 100% sure what causes the pregnancy-induced hypertension. They think maybe it's got something to do with the placenta, because obviously at the end of the birth, the placenta or after birth is delivered, and the symptoms generally go away, and the mom's blood pressure recovers again and goes back to normal. So there are a couple of theories, but there isn't anything sort of definitive as to why, or that we could pinpoint somebody and say, you're going to get it or you're going to get it. And so that is why your doctors are so careful while you're pregnant. We're weighing you, we're doing your blood pressure every visit, we get you to get that silly little stick, which is very hard to make. We monitor the and the sugar in your urine, because those are the two risks that pregnancy is. But there's nothing to know exactly who's going to get it.
Okay, Bianca's got a question. I'll take this last question. And she's asking, is it necessary to wear postpartum belly shaper after your pregnancy? And if so, when do you start? I'll just share my experience quick. With my first baby, I was a little bit scared to do it straight away. Most people wait till like they're 4 months or so. With my second baby, I bought legging shapers, just the pants, and I put them on a day after having my second baby. Somewhere along the line, I forgot about it, and I found them yesterday, and I started wearing them again because we went into quarantine and we started baking and eating things that are not very good with belly fat blasting. So maybe you can touch on that, Nurse Des, and tell us about postpartum belly shaping. Should we wait 6 months, like how some people have stressed you wait before tying your belly, or you do it immediately?
Okay, it depends totally on what belly shaper you're using. A lot of physios and guys don't like to use belly shapers that are very rigid, very, very tight. Because what happens then is that you are pulling in your tummy muscles. So you can imagine your core, okay, your muscle core, being your diaphragm and your pelvic floor, and then all the way around to your spine is like a barrel. Okay. So if you're going to be pulling in, you know, the belly shape, if it's a hard, rigid one and that's just very tight, like a Velcro strap, then what is going to happen is like taking that barrel and squeezing it. So you're going to have a bulge that side and you're going to have a bulge this side, and that's your pelvic floor that's going to bulge down. Okay, and that's not good for a pelvic floor at all, because that's, once again, it could result in a weakened pelvic floor. So you rather need to try and find a big wrap that you can wear that is made of a fabric that is suitably stretchy but gives you enough support. And there's a very good one that you can get online called Belly Wrap, and it's made by an occupational therapist and a physiotherapist. And it basically is made of a fabric that is flexible enough to not prevent that bulging up in the bottom, but it's enough to give your muscles, which are now a little bit saggy and like not quite as, you know, that take a few weeks to go back to normal again, to realign that diastasis, that separation that you have in your muscle, or realign them back in place again and support them. So they get like a muscle memory, but it doesn't make them less. And they will also protect the pelvic floor. So you're going to have to really do your research as to which wrap you're using. Now, with the belly wrap, for example, that is the one that I recommend my postnatal to use. You can put it on before you even get up and move around for the first day. So basically, before the nurse helps you to sit up and get off the bed, especially if you've had a Caesar, then just slide the wrap in underneath your bum, and then strap it in place, and then stand up, and it will just help support your cuts and help support your tummy. So that one you can wear from day one. But there are definitely shapers and wraps out there that the gynaes and the physios are not doing well. So you have to make sure you got. If that makes sense. And it's way more comfortable to wear as well than the harder one.
Yeah. Okay, I just want to just see. Okay, so Nurse Des, where can we find you after this chat? Is your handle Small Beginnings _ Durban?
Yes. I'm in Durban and have a practice in Durban North. Yeah, so I'm a Durban girl. Yeah.
Same here, Durban. That's great news. So at least I can bring Harper to you now.
Pleasure.
For a small business. Then we do visit another nurse in Westville side time to time, so it's good to know there is another nurse also in Durban that has her own practice. And yes, it was lovely to meet you. So if anyone wants to catch up with Nurse Des, her handle is Small Beginnings _ Durban. Anyone want to catch up with me? I'm at Pretty Brave Mom. Okay, thank you so much for joining us. Thank you, Nurse Des.
Thank you so much for having me.
Absolute pleasure.
Bye.
Bye.
Bye.